The following is brought to you by VerticalVet. Rethink your GPO.
Hello everybody, thanks for joining us. I am Dr. Ernie Ward, the Chief Veterinary Officer for VerticalVet, and I am so pleased to be with you today to talk about a topic that we really don't talk about very much at all, if ever, and that is how to help a staff member who's lost their confidence. And this could be the result of an injury, a bite. It could be the result of an interaction with a client or a colleague. These are the things that sort of rattle you to the core, and they make you rethink your love and passion and commitment to your practice and the profession. And today we're going to talk about it with two people I think that know this space all too well. And these are two of our very own colleagues at VerticalVet. The first is Megan Sturgill. She is a registered veterinary technician. She is our VP of operations. She's been in the industry, in the profession for over 20 years, and she's done everything from management to tech work to now working in industry. I mean, she is amazing, and she's seen this. We also are joined today by another registered veterinary technician, Lindsay Moore. She is one of our member resource advisors, so many of you have already met her and you've talked to her. She is a wealth of information, but she's been in the profession for over 13 years. Again, in nearly every type of practice you can imagine, from IR to specialty to exotics, and of course now we're so lucky to have her at VerticalVet. So guys, I want to just kind of kick it off. Let's first of all define what we're talking about. And so Megan, when we were talking around this, we were saying, wow, there are so many instances that really lead to you losing your confidence. And we're kind of using that term broadly today, but maybe talk a little bit about some of the experiences, interactions that you've seen as far as, a colleague losing their confidence.
Yeah, absolutely. I mean, I think this is a question that we really need to bring up because this happens in every practice in every city across the country. Like you'd mentioned at the beginning of this call, Ernie, there's a couple different things that can take place, right? It could be something as significant as we had a patient that lunged at one of our team members or bit one of our team members pretty significantly, to, a very aggressive client at the front desk that's making threats towards your team and your front desk workers. So this is something that I'm really happy that we're bringing up. I think one of the big kind of things that we need to think about in practice is not just saying, it happened, let's move on, right? I feel like all of these situations need to be addressed, not just with the instance that took place, but with the entire team, with management, with your practice owners, with your associate DVMs, so everybody's on the same page when an incident like this takes place.
Okay, so Lindsay, Megan brought up two common issues, I think, where maybe an injury occurred, an aggressive animal, biting, lunging, and so forth, or an aggressive client. I mean, you've worked in a wide variety of practices. What else do you see out there that can kind of shake the confidence of a colleague?
I mean, even things as small as, hey, you're having a rough blood draw day. Little things like that, when they start to add up, they can really take an effect on your confidence going forward. Even, potentially issues with a coworker. If maybe there was a disagreement or there was an issue going forward, all of those things can absolutely knock your confidence. And I think Megan nailed it on the head that it's not brought up enough. And it's let's move on. It happened. We've got other things that we need to do. And I think instead of just sort of brushing it under the rug, it is something that needs to be brought up and make sure everybody is feeling safe, confident, and supported moving forward.
Okay, so we've talked about some of the common causes, and I agree with you both. I mean, those are the issues I've seen. And I like the fact that we went ahead and brought up not just physical injuries, but also emotional toll that practice can take. And Lindsay, I love what you said. It is additive. It's cumulative. Over time, like every day, if you sort of have a toxic coworker who's berating you, I mean, that's a type of trauma that will shake your confidence. If suddenly every time a cat comes in for venipuncture and you've got this one toxic colleague who's like going, oh, Lindsay can't get it, that's going to really erode your ability. So I think that it's really important to understand that these things have impact on the practice. And so, Megan, obviously you've managed many different clinics over your tenure. Talk to us a little bit about some of the real impacts that a colleague who's lost their confidence can have on your practice.
Oh, I mean, it could be significant from how many patients can be seen in a certain amount of time to, being able to come up with the best treatment plan for a patient. So all of these things can come into play, especially when you're looking at a confidence. I mean, you could have a technician who's sitting there and their work ethic drops significantly, and you're, as a manager, looking at this situation of, what's going on? Why is the work ethic of my support team dropping? And it could be, without them wanting to express it, that they have this lack of confidence. Maybe there was something that was said to them that has rattled them to the core, where they feel like they can't do their job adequately. And it's almost this idea of self-sabotaging, right? So we, in this profession, I think we hold ourselves to this standard, and we think that so many times we can take it, and we can take it, and we can take these patients and these aggressive clients, and we can take these little things that may happen with our team members, or, like Lindsay mentioned, as far as just having those bad blood draw days. But all of those things just build up over time to the point where, it's going to be reflected in the work of your team members, from, the support staff all the way up to associate veterinarians.
Yeah, really good points, Megan. Lindsay, I mean, she did mention right at the outset that decrease in productivity, number of patients. What about when that client gets, or that staff member gets so rattled that they just quit?
Yeah, it's definitely something that I think everybody worries about. I mean, as a vet tech, we have enough compassion fatigue, especially with COVID being understaffed and people are out sick, that having to sort of pick up that slack in a sense and trying to support each other. But there is always that worry of, is somebody going to get to their breaking point in the team? And then we're in even a worse position than we were before. So I think it's coming together and trying to be able to support each other, so that way we don't get to that point and we don't let team members feel that way, is a big thing that needs to be addressed.
Yeah, and I can tell you guys, if you're watching this, this is also a leadership issue. I mean, if you've got staff members who lack confidence, who don't feel that they have the abilities to be a fantastic tech or doctor or assistant or whatever, then you really need to check yourself, because I will tell you, you need to be buoying people up. You need to be nurturing and fostering these abilities rather than tearing them down. And Lindsay, I think this is what I've seen most in my 30 years in the profession, is the fact that these toxic workplaces are really the origin of a lot of this. Like, I think a lot of RVTs and young associate doctors walk in full of enthusiasm and confidence, and yet in a few short months, it can be just decimated. I mean, have you seen the same?
Absolutely. Absolutely. And I don't think, anybody walks into a practice thinking, this isn't going to work out, because you're not going to take that job if you don't think it's going to work out. So walking in with all of that excitement and that enthusiasm, and then essentially having your bubble popped, right? Where you walk in with all this excitement and then you realize this is a toxic place and I don't know that it's the right fit. And then I do think when we're talking about that cumulative, there's the potential to carry it elsewhere, because if you're feeling hurt, you're feeling burnt out, then sometimes that follows you.
Yeah, and Megan, I mean, really, we're talking about losing confidence. I know we're going to get into some more specifics in a minute, but it's so much broader than that, right? I mean, it's not just, I don't feel comfortable doing venipuncture or handling an aggressive dog or dealing with a difficult client. This is actually the whole enchilada, in my opinion.
Oh. Yeah, and it's a guilt factor. I think there was a moment last week where Lindsay and I were prepping for this meeting, and we were really talking about the guilt that we carry on into our jobs and from location to location and practice to practice. And it's this guilt of, I did something wrong, or I don't know if I could do this procedure one more time. I'm nervous. I'm scared. I don't have this confidence. And you feel like you're doing a disservice, right? And that guilt continuously builds up until it gets to the point where you're at a breaking point. And I think that's what we see in a lot of our team members that are leaving this profession for good, is they have this guilt that they carry around, that they aren't good enough.
Yeah, I think that's so salient. Okay, so we want to focus today, family out there, that this is something you can prevent. You can actually help avoid. You can boost people up. And so, Megan, one of the things that I think that most of us that have owned practices and run practices, we understand the power of policies, having procedures that are actually written down, because I think an ounce of prevention here could save you, a multitude of problems. So maybe talk a little bit about some of the things that we can do from a management perspective to maybe help prevent some of these issues.
Oh, absolutely. And Ernie, you're speaking my love language there. SOPs are definitely something that as a practice you really need to be thinking about. So those are standard operating procedures. What are your procedures and policies in place? And don't feel like you need to revamp all of your procedures or all of your policies. You can start small, but ask yourself, do you have a policy in place that if you were not at the practice as a manager or as an owner, and an incident was to take place, that your team would know what to do? If you can't answer that with a resounding yes, then I think at that point you really need to look at the policies that you have. I mean, everything from, let's say we have a technician who was, bit by a large dog at the practice, and, you have a policy in place that they have to write that incident down in the bite log. Well, that's just kind of the tip of the iceberg if you think about that policy, right? So yes, absolutely, you need to write it in the bite log and make sure that the proper channels are taken in that instance. But you also need to be able to look back and say, okay, do we have a policy that all patients need to be on a slip lead when they go into an exam room? Could that help this situation that occurred? Do we have a policy that, if a dog is slightly aggressive or comes in with kind of that side eye, that we are going to prophylactically use a muzzle in this case? And these seem like very general topics, but it's very easy to come up with a policy that your team can reflect upon should they be presented in this situation.
Yeah, and Lindsay, one of the things, obviously I'm the training guru. I mean, this is staff training was my jam, especially back on in practices. But one of the pushbacks that I get from managers and owners to this day, 30 years in, is they go, you know what? My staff doesn't want all these policies and procedures. Even though they're designed to help, these are the guardrails that keep you from flying off the road into the ravine. So talk to us about the staff's acceptance of some of these policies that Megan was just talking about. I mean, do you guys want this, or is this an overreach, or kind of what does it look like in 2022?
No, I think this is absolutely something that I understand having a little bit of pushback on it because you know how veterinary medicine is with change. It's a slow process. But no, I think having a sort of set procedure, this is how it's going to go, this is what we are expecting, can sort of set everybody up to win because then you know what's expected. And obviously, having said that, there's always going to be sort of that gray area where, well, this patient wouldn't accept this, or we had to make a little bit of an exception. So if they're a little more of like guidelines, also knowing that there's going to be sort of those specific patients that, well, they don't really like a muzzle, but maybe an e-collar is a better option. If there's options to follow those procedures, knowing that little tweaks need to be made along the way, I think this is a great way to set your staff up to win.
Yeah, and again, that's why I call them guardrails. They're not there to drive the car for you. They don't even tell you which way to go, but they do help prevent you from crashing, or at least trying to. All right, so let's move into the next part of this, and that is when we talk about preventing these problems. I think we've touched on training, Megan, but, policies, procedures, people, like, how do we, okay, we got an SOP. We even say we're going to train on how to handle a difficult client, but how do we actually make that happen in the busy practice world?
Oh, that's a great question. I think that's probably some of the pushback I get often is, yeah, that's a great idea, Megan, but we just don't have the time. And when you really look at it, the time needs to be found. These are important cornerstones of your practice that need to be established in order for you to continue to work towards excellence, which is what I feel each and every one of our practices are trying to do. In times of busyness, I am a firm believer that the foundations that you have built in your policies are going to help maintain your well-oiled machine so that you are able to work efficiently, quickly, and with less incidences happening. But when incidences do happen, then you have a clear path. Now, I also think that it's a good point to bring up, and that is sometimes there's a difference between lack of training and lack of confidence. You can have the most trained, seasoned technician coming into your practice, working for you. They've been working for you for, 5, 6, 7 years, and they can still have an incident take place that has rattled their confidence to the point where they don't feel like they can do part of their job. And as a manager, as an owner, you need to be able to identify, is this a training issue? Do they not know how to do this this procedure or restrain in this way, or do they not know how to handle an angry client at the front desk? Or is there something else going on where they used to be able to do this, but now it seems like they're running the other direction? And I really think being able to identify that right off the bat is going to be step one.
Yeah, I really like what Megan said there, Lindsay, and that was that there's a big divide between being well trained and having clinical confidence. So in your experience, as an RVT in many settings, I mean, how does that manifest itself, right? I mean, what I'm getting at is I can do venipuncture, I can handle an aggressive dog, I'm really good at communicating with a difficult client, but yet there's become now a psychological barrier. I mean, how does that really manifest? I mean, does the technician or the associate veterinarian just refuse to see it? Do they just like suddenly go, whoops, I've got to take a bathroom break? I mean, what really happens?
So yeah, sometimes that's the case where it's like, hey, can you grab this room because I have to do something else? When really it's sort of that fear, I'm running away. I don't want to be involved in this. And I think one of the things that's really important is that communication, telling your friends, your coworkers, the vet that you're working with that day, hey, I had a bad experience with this client. I'm a little bit hesitant about going in. Or, hey, I had a bad experience with a big dog. I'm feeling a little hesitant today. Can you tag in for me? And if it's a situation where it's, yeah, we'll trade out, but I want you to be by my side while I'm doing it so you can see how I handle it. So yes, I think it does sort of come in that form of, oh, I got to take a quick bathroom break, or let me answer the phone really quickly. That's sort of how it does manifest itself. But I think talking about it is how we combat that.
Yeah, and I definitely want to get into that in just a minute. But Megan, Lindsay brings up a good point here. To me, it's observational. Like the management, the owner, the leadership needs to be sort of vigilant for these sorts of occurrences. So if you see a tech who's kind of shirking into the background every time an aggressive dog comes in, or an associate who isn't taking the complicated vomiting dog, I mean, we've got to be attentive to this. Now, in addition to just noticing it, what are the next steps that you think a manager or anyone in leadership, could just be a colleague, a friend, what's the next step they should take?
Great question. And I think it's twofold, really. So first and foremost, like you said, being able to identify that this problem is taking place. Now, I would bet that the majority of times as a manager, you have a lot of things on your plate. You might not be on the floor as much as your lead technician or your DVMs are. And so you're probably going to hear through the rumor mill, through your open door policy, that maybe one of your team members are lagging, right? They're going to the bathroom, they're taking that phone call, they're taking their 10-minute break, or they're planning their lunch break at the same time that maybe all hands on deck are needed. So I want to suggest to everybody that the first step is to really identify what's going on. Like I had mentioned earlier, this is investigating the situation before you jump to a conclusion that you have a team member that is being lazy or not wanting to work, because that's going to, by identifying that as being the primary focus in the beginning, it's going to set yourself up to have a conversation with that team member that's less accusatory. You're not working. Why aren't you working? And more, hey, the team has noticed, I've noticed that in some of these situations, you're not anywhere to be found. I'm concerned that there may be something going on. Can we talk about this a little bit, right? So you're coming at this less from a accusatory point of view and more of a, let's have a dialogue so that we can figure out what's going on.
Okay, so Lindsay, I love everything that Megan just said, but once again, from a staff perspective, how is that going to be received, right? So let's say me as the owner, I walk up and say, Lindsay, hey, I can't help but notice you've been doing whatever, or not doing whatever in this instance. I mean, are you going to get defensive about this? Are you going to welcome it? I mean, I guess I'm trying to also figure out what's the best way to communicate this in a non-threatening fashion.
Well, I think a big factor is definitely going to be the relationship between the manager and the technician, or the manager and the associate veterinarian, whatever it is. But I also think it has a lot to do with sort of the rapport at the hospital. If it's kind of becoming a toxic environment, there's the potential for that pushback of like, no, I'm doing everything and she's not doing something. I think approaching it the way Megan suggested, as a, hey, we're worried. we're not accusing you of anything, but we're worried. We feel like maybe you're lagging a little bit. What's going on? We want to help. Coming at it from that perspective, I think is a complete game changer. But I think it is very important to be aware of your surroundings and sort of what the vibe is at the clinic to sort of approach it appropriately.
And Lindsay, I'm so glad you said that. This is why I mentioned earlier this is a leadership issue, because if you don't have that environment that is welcoming and receiving of these types of messages, then of course it gets defensive, it shuts down, and toxicity builds up even further. But Megan, let's walk back through that, because I have a feeling that a lot of our Vertical Vet members would struggle with this conversation. Like they would genuinely say, I'm a little apprehensive about approaching Lindsay about an issue because maybe I'm wrong, right? Or more importantly, historically, on their experiences, they know that Lindsay pushes back and gets defensive. So how can our members initiate that conversation when it's warranted?
There's a couple different things that they can do. And we'll talk about this in a different kind of situation, further on in this conversation. But I'm also a fan of the buddy system. So yes, they are conversations that need to be kept confidential between you as a manager or an owner and your team member. But in some of these situations, it can be helpful to bring in, that individual's work buddy, right? So your teams, kind of the people that are close with each other and those that are closer than others. And so in some of these situations, it can be beneficial to bring in that team member's, work buddy. And so you're having a conversation, and it's not ganging up on that team member at all. But I would guarantee to bet that that buddy has probably seen some of these situations take place as well. Open communication, open dialogue is so important. We need to come at this, instead of looking as a manager and an owner as kind of a top-down approach or a parent-to-child conversation, but rather a peer-to-peer conversation. So yes, you might be the leader in your practice, but you are managing adults. And so to be able to have an adult to adult conversation and bring in a support system for that team member while you're having this can be really, really helpful.
Yeah, I love what you just said there. And Lindsay, again, I'm just going to keep bouncing back to you because you have worked in so many different clinical settings. What I found is the fact that most managers, leaders, owners completely abandon this conversation. What'll happen is they'll hear it through the rumor mill, as Megan described, and they'll go, well, Megan, if Lindsay's doing that, why don't you have a conversation with her? They'll completely abdicate. And for me, I always believe that no, actually the owner, the manager should initiate these conversations, because that does create a cultural shift. What about you from a staff perspective? Would you rather hear it from a coworker, maybe even a friend, or would you rather your manager owner come in and have a very polite, civil conversation with you about an issue?
I think it, again, depends on sort of the vibe that's at the clinic. I have had situations where a coworker has come to me and said, hey, you seem off. Like, what's going on? Why is this happening? And that was sort of a nice way to come about it. And I was like, kind of like self-check, like, oh man, I got to get myself together. I feel like I'm letting my team down, and they're noticing that. I've also had situations where I've had management come to me and say the same thing, like, hey, what's going on this week? You seem a little bit off. And I think either way is an appropriate way to go about it. But I think it's important that you know your staff member that you're specifically talking to, and also sort of what their relationship is with their coworkers. So if you know it's that buddy, then yeah, maybe ask that buddy to say, hey, Lindsay seems a little off. Did she mention if anything's going on? And then, if it's just a bad week, then okay, we'll maybe give her till next week and see if she works it out. But no, I think either way, I think it just depends on that specific staff member and the relationship that you have with them and what you think would make them more comfortable. But I think either way is correct.
Yeah, and I agree. It's knowing your team. It's knowing your leadership style. I mean, there's no clear answers. And I think sometimes, Megan, managers and owners get frustrated, like, well, what do I do? It's like, well, it depends. And that's the right answer. It's not always like, well, this is what you always do. And that leads us sort of to this last part of the communication. And that is, how do we help them regain their confidence? And I'll be honest with you guys, I believe that this is more the result of chronic beratement from a colleague or toxic management leadership than just like, I got bitten today. Like that happens, don't get me wrong, but I see a lot more of people that just constantly just chip, knock down, and suddenly they're a hollow shell of their former self. So how can we help them? I mean, so Megan, I'd like to start with you. I mean, you've got this situation, it's real, they're losing their confidence, it's impacting their ability to do whatever their job position is. How do we go about by actually helping them, not just talking through it, but actually getting them to regain that confidence?
Absolutely. It depends a couple things on the situation, really, like you had mentioned earlier. So if we're looking at a hard skill issue, meaning I have, a technician, I have an associate that used to be able to do one skill set, and now they no longer seem to be able to do it well, effectively, safely, then that's going to kind of require a certain mindset in, coming into that conversation. One of the things that I think is most important is making sure that you have kind of an open plan that you've created with that team member. So you've identified the problem, you've identified where that lack of confidence is coming from, and then you're sitting down with that employee and coming up with a plan that makes sense for them. So in the case of, I am a technician and I've been rattled, I was bit by a large dog, and now I no longer have the confidence to be able to restrain well or to be able to interact with those types of patients, then we're going to start off small. Maybe it makes sense in those situations to have a buddy system going so that technician has somebody that's with them in that situation that can take the lead and kind of help work them through some of their confidence. If it's one of those things where they've lost the confidence a little bit, we're nervous to enter this room, I mean, our patients can sense that. I think there are some situations where you can lean on different types of training methods, right? So if we're looking at being able to effectively handle patients that might be aggressive, are there other types of training that technician or that support staff can do to be able to help boost their confidence? I'm thinking, maybe fear-free, maybe some behavioral CE that's out there. Are we able to recognize some of the behaviors in our patients before those behaviors turn into something that could potentially be negative? And in the case of more of those soft skills, so those communication skills, I think that it does take a unique person to be able to handle some of those things as they're happening. And so being able to revisit how we're interacting with clients, after every conversation, kind of going back and saying, how did that go? How did it work out for you?
So Lindsay, I guarantee you a lot of our members that are watching this today, they're saying, okay, that all sounds great, but I can't even talk to my manager about it because she's the problem. Okay. So now we're kind of reliant on our coworkers. So let's say that you as a colleague are witnessing the manager or the owner constantly chip away at the confidence of a colleague. What do you do?
I think one, you have to fall back on your team. So if I know that Megan is struggling and I see it, then yes, I want to step up and say, listen, Megan, I know management is giving you a hard time. I see that you're struggling. Let's do this together. How do we help? How do we go forward? I also think it's fair to tell that management, hey, you're kind of picking on her. She's trying, she's doing the best she can. Maybe take it a little bit easy, because I have also seen where, a manager may think tough love, right? Like, I'm trying to support you, I'm trying to motivate you, but that may not come across that way to that particular staff member. So I think it's a matter about, again, opening up that conversation. Do I need to talk to that manager and say, hey, this staff member is having a really hard time. I know you're trying to help motivate them, but I don't think you're going about it the right way. And also supporting that staff member and be like, hey, she's giving you a hard time. Let's work through this. How can I help you going forward? Let's team up on this. So I think it's important to fall back on your team. Let them know the struggles you're having. Let them know that you see them, they're trying, and sticking together.
Yeah, and I'll tell you, one of the most frustrating aspects of this whole conversation, I know that those of you watching today will relate, and you have to be willing to hear. If you are a manager or an owner, and Lindsay comes up to you and says, hey, it seems like you're picking on Megan, you've got to accept that. Like, you just can't shut it down, be dismissive, and that's the hardest advice I can give you, because to be able to accept that, to let go of your ego and listen that is actually what you need to do as a leader, right? I mean, and Lindsay may be off the mark. I'm going to be honest. There's some times when I've had complaints that just were completely illegitimate, not grounded in reality. But at the same time, I listened to them. I heard them out. And I didn't get defensive. In fact, often I didn't even make a retort. I would just say, I really appreciate you bringing this to my attention. Let me look into it a little further and maybe let's talk tomorrow. Like I would always give myself time to process it, Lindsay and Megan, because, I felt like, wait, maybe I'm missing something. There's a blind side here. But I want to also impress upon the Vertical Vet membership, these are courageous conversations. And that's why if Lindsay brings it up to a manager or an owner, that takes an act of bravery. And so I want to make sure that I listen attentively because who knows, I just might I might learn something, by listening. Megan, as we sort of finish out the conversation today, there are instances where a client is causing the trauma. And I've seen this in my own personal, experiences. I've seen a client go off so hard on a team member that team member just had to go home that day and maybe missed a week. How do we help them regain their confidence with the public? Because that's another higher order of magnitude issue. I mean, so now it's a receptionist, somebody laid into her, made threats. I mean, you know how ugly it can get out there. How do we help that person?
Yeah, absolutely. And I think we're seeing more and more of that, especially as we've, worked through the last couple years with the pandemic going on and people just being kind of at the end of their rope and they don't know what to do. One of the things that I think is really, really important when we're focusing on kind of those communication skills is being able to pull that team member aside who's been rattled and ask them what they need in that moment. Do they need a minute or a couple days to kind of sit back and maybe work on another project before they're able to go back at the front desk? That's not admitting defeat, but it's saying, take a couple days, let's take a breather, let's put you on this project, and then we'll put you back, at your primary role. There can be other things as well. I mean, maybe you are a practice and you do something fun with, an event that's outside of the practice or, some sort of project that you're doing within your community that you can put that team member on where they're front and center in a very upbeat and fun environment where, really you're just looking at smiling faces rather than having to deal with that angry client at the front desk. And finally, as a manager or as an owner, I think it's really important that you have a policy in place that says we're going to allow, this behavior with our clients, and we are not going to allow this behavior with our clients. Because right now, what we're seeing, especially with the high turnover in practices, is that this idea of, the patient, the client is always right. We're going to bend over backwards to meet their needs. We're just going to take all of their insults or their angry words. We're just going to take it because they're a patient, they're one of our numbers, and say, no, we're not going to do that in our practice. We are not going to belittle our team. We are not going to lower our standards to meet the needs of this client. Here are your records. Where would you like me to send them to? And that can be really scary as a manager. That can be really scary as an owner. I'm sure, Dr. Ward, you've had to deal with this with your history. But being able to do that as a leader in the practice really shows the team that you have their back, that, yes, your clients are important. They're obviously a source of revenue. How the whole practice work is based on pet parents. But to be able to say, we're not going to tolerate this can be a really big confidence booster, especially for the team that's at the front desk.
Yeah, put your people first. Lindsay, again, because this, as we finish up today's conversation, I mean, this is a hot topic, especially in these days. So now you've got this colleague of yours, and I can tell you it can come from both the clients or even your owner or an associate vet. But you know what I'm talking about when I say they're like, I'd rather see someone else, So suddenly now they question your clinical abilities, right? My dog doesn't like you. Right? I mean, or, oh, you're not as good with cat venipuncture, right? Those little chips. How do we help that colleague who suddenly one day walks in and goes, you're right, I'm not good with aggressive dogs, or boy, I'm lousy with small cat venipuncture. How do you get them back to normal?
Support, 100% support. Hearing them say, hey, I'm really bad at cat veins, and saying, okay, well, why is that? Well, come over here and watch me. Let me tell you a couple tricks that I've tried. If this doesn't work, maybe try this, to sort of help support them in a, hey, we're not letting you give up. we understand you've got maybe some issues, some hard times, but we're going to support and help you through this. So I think it's a matter of, sort of hearing them out. We understand that you are worried about your confidence, that maybe you're concerned about XYZ, or even, if the client's like, listen, I don't like you and I want somebody else. Okay, well, great. We need you in another room. So we'll hand them off to somebody else while you help take care of this puppy, whatever, to sort of help support them. And I think keeping it as positive as possible and using it as a learning opportunity, especially if you've got new people coming on board. Hey, we're learning how to restrain an angry cat today. This is what we're going to try to do as sort of a team situation. So we're all learning together and we're all supporting each other. But I think it's about, again, like Megan said, buddy system. No, come over here. Let's work through this together.
Right. It's not you, it's them. But then you've got to quickly follow that up with, you're amazing at whatever that thing is. Because if you ignore it, then what will happen is over time, that person will become, look, lack of confidence, burnout, just frustration. You'll lose that client. And I'm sorry, that staff member. They will leave you because of these just constant, unrelenting attacks from colleagues or from clients. So Megan, as we finish up today, any last bits of advice? I know that we've kind of covered a lot of ground in a short period of time, but what about last bits of advice? And then Lindsay, will go to you to finish it up too.
Really, the last bit of advice is as a leader within your practice, whether, again, manager, owner, maybe you're a technician leader, maybe you're an inventory manager, is really looking and making sure that you have policies in place that are going to support your mission as a practice and that can be leaned on in some of these harder times. So that's really what I want to bring home in this conversation. Secondly, it is very hard to have these conversations, but the only way that we grow as a practice, that we grow as individuals, that we grow as a team, is that sometimes you have to have these hard conversations in order to get to the next level. But being able to reflect on it and not come at this from an accusatory standpoint, but more of a helpful standpoint. How are you going to be able to help this team member work through some of the issues that they're facing? And it might take a little bit of investigative work. I don't think that you can come at these situations and say, I see this problem, I'm going to solve it in 15 minutes, and then we're going to go ahead and see, the foreign body that's coming in for x-rays, right? We can't have this thought process that we're going to get through all of these different segments so quickly. We need to give this time. We need to be able to have open conversations. And like Lindsay said, really have the support of the entire team behind each and every one of your individuals that may be going through, some of this lack of confidence time.
All right, Lindsay, any final thoughts from you on helping a colleague regain confidence, how to prevent this from happening in the first place?
Yeah, I think, advocating for yourself and advocating for your team. We advocate for our patients all the time. That's literally what the job is. And so I think being able to, say, if I'm having a hard time with something, hey guys, I'm struggling today. Can somebody help me with this? Or trying to be able to recognize it in a staff member. Hey, what's going on today? Can I help you with something? What can I do to support you? I think is immensely, immensely important. Fall back on your team if you need that support. Find a colleague. If you and your manager are close, ask for help. There's nothing wrong with it, especially if it's, hey, I'd really like some additional training, like Megan mentioned. If my manager came to me and said, hey, I want to send you to this CE about behavior, I'm all for that. Sign me up. And so I think being able to advocate for yourself, ask for help, or have your colleagues back, I think is going to make a difference in the practice, as well as hopefully in your management going forward if you need that support.
And that's what Vertical Vet is all about, helping you grow your practice, because we know that by having wonderful people like Megan and Lindsay as part of our team, they've got your back. So if you have questions, that's what we're here for. That is why we are a community, because of people like Megan and Lindsay. And again, they're just two of many that have been there, done that. Megan, how many RVTs do we have on the team now?
I think we have 5. I think we have front desk workers, emergency technicians, general practice technicians, practice managers. We got a gambit, Ernie.
We do, and we're here to help. So we want to help you grow. Again, I want to thank you guys for joining us today. I know we're all busy here at Vertical Vet this time of year, but again, let's thank our 2 registered veterinary technicians, Megan Sturgill and Lindsay Moore. Thank you guys so much.
Thanks, Ernie.
Thanks, Dr. Ward.
Well, listen, guys, I want to thank you for spending some time with us today. Again, when we founded Vertical Vet, we knew it was more than just a GPO. And we want to force you to rethink that because we're here as a community. We're here to give you guidance, be a shoulder to cry on, and again, to maybe help you manage some of the perils of practice. And that's why we have amazing team members like this. So if you're a member, you already know we're here. You can rely on us. Definitely reach out to us if you have any questions, whether it's about an order or about a personnel problem. Chances are we've got somebody who can help you out. If you're new to Vertical Vet, definitely take advantage of this. And if you haven't yet joined, then why not? Because 2022 is a great time for you to join a community of like-minded veterinary professionals who are just trying to make the world a little better. So again, on behalf of the entire amazing team at Vertical Vet, I am Dr. Ernie Ward, Chief Veterinary Officer. We will talk to you soon. Bye.